We have above our lateral aspect, superior lateral aspect of our eye, we have a lacrimal apparatus, and this is what produces tears, constantly produces tears that flow across the eye and drain into a lacrimal sac at the medial aspect, right at your caruncle, right at the little red triangular area at the medial aspect of each of your eye, a little triangle. That's called the caruncle. Right there, there is a lacrimal sac, and the tears drain across the eye, and they actually drain into the lacrimal sac, which then drains into the nasolacrimal duct, which drains and delivers those tears into your nose, which can then go into your pharynx or wherever. This is why when you see those children crying a lot, their nose is running with that very thin, disgusting mucus. This is because they have so much of those tears going through, and they are osmotic. They are going to pull a lot of water into that area, into those mucus-producing cells. Normally, we don't have the tears running out of our eyes because we have sebaceous glands around our eyes that produce oil. You've heard the saying, oil and water don't mix, right? Well, keep a little band of oil around our eyes. It helps to keep the tears in until you take one of these tests. I think somebody took your tears. Also, to protect our eye, we have, of course, we actually have our eyebrow and our eyelashes that help to keep larger particles from getting into our eye. We have our eyelid. Our eyelid is what is the area in our body that has our thinnest skin, is in our eyelid. Thinnest skin. And of course that helps keep things from getting into the eye. We have other structures too. We'll see the conjunctiva shortly here. The orbit is a cone-shaped cavity formed by the skull that houses protects the eyeball. There is some fatty tissue around it, helps protect it, of course, from shock. That makes sense. And then we have 6 muscles that attach directly to the eyeball. These are the muscles that actually cause the eyeball to move around. There are 4 rectus muscles and 2 oblique muscles that move the eyeball around. Okay, we saw that. Conjunctiva. The conjunctiva. You may not be familiar with the term conjunctiva, but you've heard of conjunctivitis. Conjunctivitis. This is what people call pink eye, inflammation of the conjunctiva. Conjunctiva is a membrane that partially covers the eye and then folds down into the eyelid. This is where we see the blood vessels. When you look at the whites of somebody's eyes, we're actually looking through the conjunctiva, and you can see the blood vessels there. We've already talked about the lacrimal gland. Cleaning and lubrication. Tears are made for cleaning and lubrication, and they have an antibacterial property to them, partially in the fact that they help flush things away, they help to wash things away, that in itself. Okay, you can see here, the lacrimal gland has superior lateral location. You can see how it drains the tears. They're going to run across the eye into the lacrimal sac, then the nasolacrimal duct. This right here, this is called the caruncle, this little pink tissue right here. Of course, you can see the whites, this is sclera, and then the iris is the colored part, and the black area is the pupil. Of course, the pupil is not an actual physical structure. The pupil is just an opening. You cannot dissect an eyeball and hold a pupil in your hand. It is just an opening. Not surprisingly, the eyeball is shaped like a ball. Has 2 chambers in the front, towards the anterior portion of it. Let me see if I can get it that way. There we go. We have the 2 chambers in the front of the eyeball here, anterior and posterior chamber. You can see it is globe-shaped for the most part. There is a protrusion right here. The white area, in fact, if you took out an eyeball, you'd notice that most of it is white, shaped like a ball. That is the sclera. You can only see a little bit of it when you look at somebody's eye. You see the whites of their eye. So you can only see a little bit of the sclera. You can notice here an inferior and a superior muscle. These are rectus muscles that are attaching directly to the sclera. They insert directly into the sclera. You can see where the optic nerve leaves the eyeball as well. All right, important things. The conjunctiva is going to cover the anterior portion of the eyeball here and here. It's not going to cover the cornea. The cornea is this area that is sort of bulging out, this protrusion. Something that is unique about the cornea, it does not have any blood vessels. The cornea does not have any blood vessels, therefore it does not have an immune response. The cornea does not have any blood vessels, therefore it does not have an immune response. That's an important concept, because if an organism can get there, if some pathogen can make it to the cornea, well, then it can get all the nutrients that the cornea would be getting without having to fight off the immune system. And the cornea gets its nutrients partially from a little bit from the tears, but mostly from the fluid that is behind it that we'll talk about in just a second. There's a really cool parasite called loa loa, also known as the African eyeworm. This guy is smart enough to know that if he makes it to the cornea, he can avoid the immune system. That's a pretty smart worm. It's loa loa, L-O-A-L-O-A, the African eyeworm. Most of you in here are probably infected with it already. No, that's not true. No. Fingers crossed. There you go. All right. Then we have a choroid layer that lines the interior portion. You can see it here. The choroid layer is in the red, not in the yellow. It's in the red. Choroid is where we find all the blood vessels, for instance, that bring all the nutrients to the inner part of the eye. And then it extends right here as the ciliary body. And then part of that as the iris. And the ciliary body produces a fluid called the aqueous humor. And the aqueous humor, which is continuously produced by the ciliary body, is going to flow from the posterior chamber here up through the pupil here, filling this space in the anterior chamber, and then draining out here and here in a trabecular meshwork, and what's known as the canal of Schlemm. If you're going to name a canal, whose name is that? Canal of Schlemm. It's an important concept, because if we have fluid that is continuously produced from the ciliary body in the posterior chamber and is continuously flowing through your pupil, which means, in other words, as you're looking at me right now, you're actually looking through fluid, right? You understand that? Okay. So it's continuously produced, it's continuously flowing through the pupil, and it's continuously draining. If we have a problem where there's a blockage in the trabecular meshwork or the canal of Schlemm, it's not going to drain completely, which means it's going to continuously be produced, continuously fill up this anterior chamber, but not drain out like it should. Which means we're going to have increased pressure. This is something we call glaucoma. Have you heard of glaucoma? I know you've heard of glaucoma, right? That is what glaucoma is. We have fluid that is continuously produced but not continuously draining. Increased pressure, that's going to cause problems. Now hopefully you have a better understanding of what glaucoma is. Notice how the ciliary body has these little tiny ligaments that connect to the lens. And the lens is a disc made up of proteins in a crystalline-like structure. And it's interesting that these little tiny ligaments, when they pull on the lens, will actually flatten it. It'll pull and actually flatten it, or change its shape. Anybody ever dissect an eyeball? It's amazing how solid a lens is, and that these little tiny ligaments can do that. Can alter the way the light's coming in. It's pretty amazing. The pupil again is the opening. Why does it look dark? Same reason why it looks dark when you're looking into a cave on a bright sunny day. You're looking at the front of a cave, all you see is a big black hole in the wall, or at least in the cartoons. All you see is a big black hole in the wall. There's no light inside. That's why all you see is dark. Well, same thing with the pupil. The idea, the reason you see nothing but pitch black because there's no light in here. At least not that you can see. That's why when that doctor comes up to you and wants to look inside your eye, gets up real close, sticks that thing right there and shines the light back in here so you can see what's going on back here. And you can see this yellow lining is an important lining. That yellow lining is called the retina, and it is within the retina that we find all of our cells that are picking up the light signals. Anybody know the types of cells that pick up light signals? Rods and cones. Named because the rods are shaped like rods and the cones have a cone shape. So you can see the retina sort of lining the entire inside of the eye. This right back here, this is called the posterior cavity. Posterior chamber, anterior chamber, posterior cavity. Posterior cavity is, other than the retina, the choroid, this is pretty much empty of anything but vitreous humor, which is a jelly-like fluid that sort of helps to maintain the shape of the eyeball. You can see there's an opening right here with the optic nerve. It leaves, takes that information from the retina, sends it back to the brain for interpretation. The fovea is an area directly behind the pupil, straight back. So it's a landmark that is often used. You see that in medicine. At the optic disc right here, another landmark. It's often referred to as the blind spot, because there's no rods or cones right there. Kind of makes sense.
What structure separates the anterior and posterior chamber?
What structure is separating them?
The iris.
The iris. Okay, sclera is anomous, sclera, okay, talk about sclera, things of cornea, transparent, curved, choroid, vascularized, pupil. Okay, behind pupil is a lens. The little things can change. Change the shape of the lens, making it thicker, thinner, allowing light to come in and focus on the retina. This process is called accommodation, which changes the size of the pupil and the curvature of the lens to make sure that the light goes to the right place. See that when we talk about proa accommodation. The retina, as we said, has all the light sensing cells, the rods and cones. The rods are very sensitive to light. Rods only require 1 photon of light to activate them. And a photon of light would sort of almost be like a molecule of something, okay, when you're thinking of something very, very small. So a rod only requires a little bit of light to activate it, but all it gives us really is shape. Whereas the cones, which require much more light, give us color. That's, and fine detail. That's why you can look across a dark parking lot at night and you see somebody standing on the other side of the parking lot. You can sort of tell it's a guy standing there, and you can sort of tell he has a hat on, and you can sort of tell he has a coat on, but you can't see what color it is until he steps underneath the street lane. And now you can see it's a green hat, green baseball hat with a brown coat. Because without all that extra light, you couldn't make out the detail, you couldn't make out the color.
Except if it's the sodium street light.
I'm sorry?
Except if it's a sodium street light, and then it metabolizes the color and gives you a different read on what it actually is.
Well, and if you think about the color at all, realize when the light hits something, anything, it is absorbing all of those, the light, except for that particular color. So you can almost say that shirt that you're wearing is every color but green, because it's the one that's bouncing back, right?
Yeah.
But then that puts us in a whole time warp, back to the future problem. We don't want to do that. Information sent to the brain, we know that. Okay, here we go, moving on. There it is. We have 6 muscles that turn the eye. Ah! Okay. We have 6 muscles that turn the eye, and it's very, very easy to remember them because there's 4 of them that are rectus muscles. I don't think this is in the book. I don't remember them. Are they in the book? Yeah, I'm going to tell them to you anyway. There are 4 rectus muscles, which are really, really easy to remember. Because remember, rectus means straight. So the 4 rectus muscles are located superiorly, inferiorly, medially, and laterally. And the nice thing about a rectus muscle, you know that with a rectus muscle, it's just going to contract, it's just going to pull, it's just going to shorten. So when you think about a superior rectus muscle, it's going to attach, it's going to insert on the superior aspect of the eyeball. When that muscle shortens, it's going to pull the eyeball so the eyeball pivots up. So in the name superior rectus, you get the information that this is a muscle that's located on the superior aspect of the eye, and when it contracts, it's going to turn the eyeball up. Inferior rectus, on the inferior aspect of the eye, when it contracts, it's going to turn the eyeball down. Medial rectus, on the medial aspect of the eye, when it contracts, it's going to turn the eyeball medially. And the lateral rectus, on the lateral aspect of the eye, when it contracts, it's going to pull the eyeball so you're looking laterally. So up, down, right, left. But again, notice that when I'm looking right, it is my left medial rectus that's pulling my eyeball this way, and it is my right lateral rectus that's pulling my eyeball this way. That makes sense? So that's 4 of the 6. The other 2 are the oblique muscles. And the oblique muscles are a little more confusing because even though the superior oblique is on top of your eye, when it contracts, it's going to contract around a pulley almost, which causes the eyeball to sort of spin down this way, sort of spin down, so that you're looking at the tip of your nose. Superior oblique, even though it is located superiorly, when it contracts, it causes the eyeball to look at the tip of your nose. And the inferior oblique, even though it is located inferiorly, same idea, it's going to make the eyeball turn up and away. So, by being able to control these muscles, we can make our eyes move in all these different directions. Okay. Anisocoria, unequal pupils. It can be a concern. we're human beings, so we're not perfect. So it's not surprising to find out that a lot of people have a little bit of unequal pupils. Sometimes it's hard to tell if they're unequal or not unless you change the light, unless you change the environment. And then you turn the lights off and you expect one pupil to get really large and it doesn't. Pupillary construction is controlled by the oculomotor nerve, cranial nerve 3. I already saw that. Isochoria may be an injury or bleeding or tumor. Okay. Maybe normal. There we go. You guys know the difference between these doctors? MD, not MD. Ophthalmologist. This is a doctor. This is somebody who went to medical school and then did their residency specifically in ophthalmology, whereas an optometrist went to a eye doctor school, which is located in the plaza right next to Big Lots. I'm just kidding. I'm sure they're wonderful people. No, they are. Two people. Here we go. I'm not one of that. Acute eye pain, red eye are always common. You can see the subconjunctival hemorrhaging. You know this. You know what can cause little bleeds in the eyes. Any little trauma can cause bleeding in the eye. Like that. That is a laceration of some kind with some bleeding underneath. Blunt trauma to the eye, cause swelling, bleeding in the anterior chambers of hypedema. Patient's head should be elevated, decrease intraocular pressure. Anytime you have bleeding around the eyes like that, you should do it, just in case. Blunt trauma to the eye can result in a blowout fracture. Oh, this I saw in the book. They do a nice picture of that. Pretty good laceration. Penetrating eye trauma. You're going to shoot your eye out. UV pellets, lawnmower projectiles. If you have not learned by now, when you're walking past, driving past, biking past, jogging past, you're going past somebody running a lawnmower, never look at them, okay? You should know this by now. If you do not know this, anytime you're walking and you're going past somebody with a lawnmower, always try and look the other direction or turn your head, because stuff flies out of these things all the time. You'd be surprised. Grinding injuries, you get a lot of that in metal shops. Those little particles come flying off of welding shops, working around cars. Knife wounds, gunshot, of course. There's a blowout. Yeah, it's going to be difficult to fix. Chemical injuries, of course. Anytime chemical injuries hit the eye, hit the skin, you do the same thing, right? What do you do?
Flush with water for 15
Flush
minutes.
it with water. Minimum 10 to 15 minutes, minimum. And just keep going. If you have more time, keep going. Ultraviolet keratitis. Oh, this is what happens when the person who's welding, one person's over here welding and somebody else walks over and goes, hey, what are you doing? Just as they start welding, they hit that arc flash. Yeah. Their canal of Schlemm. There's our glaucoma. Patient complains of cloudy vision, eye ache, frequent noise and vomiting. There's a key phrase that a patient will say, however, when they have cataracts. Again, I don't remember seeing cataracts in the book. Cataracts is when the lens starts to become cloudy, the lens starts to sort of cloud over, those protein crystals start to clump together. Very common thing they say is, it's like their vision's like looking through wax paper. Are you familiar with wax paper? Stuff used to cook with and do other things, like obviously. That's one of those diagnoses you can make over the phone, quite frankly. You know, when somebody says, my vision's kind of blurry right now, and it's like I'm looking through wax paper. You kind of make it over the phone. But you often see cataracts in patients who are older and smokers. So don't smoke and stay young. All right, are you ready to talk about what we can hear? Okay. Ears, responsible for hearing and balance, partially for balance. But again, is balance really maintained in your ear? No. Just like we don't hear with our ear. All we have in our ear for balance are some specialized sensing cells. Where do you think balance takes place? I'm going to say in your brain somewhere. Cerebellum's a great place to start. On cerebellum. External, middle, and internal ear. Here we go. When you think of somebody's ear, this is the auricle or the peanut. This part here. The helix is, they don't have a label here, is the little curled over part that extends almost all the way down to your lobe. There's another little part sticking out right here called the tragus. Are you familiar with this? Sometimes ladies get this little part pierced. Little tragus right there. Nobody cares. Okay. External auditory canal. This area right here. The opening to the external auditory canal is the external auditory meatus. I told you the term meatus is an opening to something. External auditory meatus opens to the external auditory canal. Within the external auditory canal, there are specialized cells that produce a substance called cerumen. Cerumen is a sticky, waxy sort of substance, which is actually in our ear to help keep our ear clean, believe it or not. This is what we call earwax. Cerumen is earwax. And as you chew or as you talk, what happens is that causes the movement of the cerumen laterally. So more and more towards the outside. So what happens is it starts here, then it moves this way until it gets towards the outside. And the benefit of this is that it is much like a snowball rolling down a hill. As it goes down, it collects more snow, but it also collects debris, twigs and leaves, and children. As it rolls, as the cerumen moves this way, it is going to collect more cerumen, but it's also going to collect dirt, debris, as well as bacteria, and help just keep moving it this way. So that when you clean your ears, you need only clean the external auditory meatus. Do not stick anything into here. Start shuffling around. Yes?
Is it a concern for physicians when there's too much serum, they want to flush it all out?
It can increase the likelihood of infection. And if area of infections occur around the tympanic membrane, then it's going to cause damage or cause scar tissue to the tympanic membrane, which make hearing more difficult. Is it life-threatening? No.
So
Not
too
really.
much serum is bad.
Too much cerumen. The cerumen, we call it impacted cerumen is bad. It's all stuck there. I want to get it out. I do not recommend buying one of those things over the counter that they have now to suction. Have you seen these? That you're supposed to spit in your ear and it sucks the wax right out. I'm a little concerned about that because I don't know how much pressure that it creates against the tympanic membrane, so I wouldn't recommend that at all. But how about the candles? I would say, with that following your physician's advice, because again, the reality is, if it's just right here, it doesn't need any extra removal. Another thing sometimes people like to do is hydrogen peroxide. Do you know that we don't use hydrogen peroxide anymore? Are you aware of that?
Who's we?
People in the medical profession. Do you know this?
I used to
Okay.
get blood off my uniform.
I'm sorry?
I used to get blood off my uniform.
Okay, that's fine. But as far as on your skin,
Yeah.
because the reality is it can do more damage to perfectly good tissue. So nobody uses it anymore, other than to get blood off your uniforms.
A lot of the over-the-counter stuff, for the hair wax removal, contains hydrogen peroxide.
Mhm. Yeah, I know. That's why I'm not recommending any of that. I wouldn't recommend putting rubbing alcohol in the ear either. Although sometimes doctors will do this.
Well, water works fine.
Sometimes doctors will do this. They'll pour alcohol into the external auditory canal, especially if the person has a bug in here, because it kills the bug pretty easily. Have you heard these stories where bugs go into somebody's ear? Understand something, this is a dead end. It's not going to crawl to their brain. Nothing crawls to the brain.
What about the worm?
What about the what?
The worm goes into your eye, through the
The worm that goes into your eye, that's different, that doesn't go
ear.
into
No,
the
it goes through
brain.
your ear to, it was on Dr. House. Now you're in story.
There's not a worm that goes through one's ear. There's the amoeba, the Naegleria, that goes up the nose to the brain, but nothing goes through the ear. That's a dead end. Even if somebody had a meningotomy, you know meningotomy? Even if somebody had the tubes in their ears, and there were a child that still had tubes in their ears, even if that were the case, it's still a dead end here. We run into bone. And we have a better pathway. Things don't crawl through the ears up to the brain. So the only time that you'll ever hear doctors putting alcohol in here is if something does crawl in here and gets stuck. If it's still alive, or just to make sure it's dead, they'll pour alcohol, rubbing alcohol, and it just kills it and helps it clean the area very quickly. But it's not something that is recommended.
Where did the tubes go? For drainage?
You want to know why? You think I'm going to take you there? Because then, this is the external auditory, this is the external ear, next part is the middle ear. Separated by the tympanic membrane, it's what people call the eardrum. We have the middle ear is the next part, and you'll notice just medial to the tympanic membrane is the eustachian tube. And the eustachian tube leads to, is a connection to, is a pathway to the throat, the pharynx. Now here's the thing about the eustachian tube. In children, their eustachian tube is shorter and more horizontal. In adults, the eustachian tube is longer and more vertical. Which means any pathogen that happens to be in the throat, the mouth-throat vicinity, in a child only has to move a little bit uphill and not a very far distance. Once pathogens make their way up here, now they can hang out. They don't have to worry about getting washed away or flushed away or anything like that. So they're going to hang out here, which is going to cause tissue damage. And when a person has tissue damage here, when their tissue get damaged, what happens? What's it do?
Dies.
What's the tissue do? What do the cells do?
Dies.
And then when they die, when they're dying, what do they do? When the cells are dying, what do?
Cause inflammation.
Call for help.
They call for help. And who comes? Everybody. What do we call that process? Inflammation. And so when there's inflammation, what's the next thing that follows inflammation?
Swelling.
Swelling. So now we have a whole bunch of swelling on the back side of this. A lot of pain. These kids are always pulling at their ears, crying. Mucus dripping out of their nose. So if this chronically occurs, we want to get rid of the fluid that's back here. How do we get it to drain out? Put a little slice right there and stick a little tube in. It's not like a tube like you'd think, really. It's difficult to imagine, but it's not like a tube. It's like a rubber seal almost. Because it doesn't have to be very big, you know. It just sits right in there, the fluid drains right out. You ever wonder why kids get ear infections all the time? The only time they don't have an ear infection is because they've just gotten over an ear infection, or they're about to get an ear infection.
What would something like Smart's ear be in?
Hold on, I'm not there.
Hold your horses.
I know you have a question too. So, this is why we see kids getting ear infections all the time, and they are usually middle ear infections, and this is called otitis media. Middle ear infection is otitis media. So an infection in the external auditory canal is going to be called otitis externa. Auto is ear, itis, inflammation. Otitis externa is what some people often refer to as
Swimmer's ear.
swimmer's ear, as Ed often refers to as swimmer's ear. Why would it be called swimmer's ear? Well, because water gets in there, and everybody knows how dangerous water can be. What's the problem with water getting in there? Well, is it the water itself? Not really, of course not the water itself. I'm sorry?
Brings bacteria.
It does bring bacteria, it does bring pathogens with it, especially if you're swimming in lakes or streams or lakes, ponds, rivers, etc. So it does bring pathogens with it. That's one problem. But what about in those swimming pools that are chlorinated? You don't have to worry as much about pathogens then. What's the problem with that? Well,
Just chemical irritation.
I'm sorry?
Just irritation from the chemical.
Could be chemical irritation. But what happens when somebody gets water in there and they can't get it out? The first thing they do is they jump up and down, side to side, hitting the side of their head. If it still doesn't come out, what do?
Stuff in
They
there.
get their towel and they twist it and they stick it in there. Or they get a Q-tip and they stick it in there. Or they get their finger and they stick it in there. So it's not just about chemical irritation, not just about potential pathogens. It's also about people trying to get the water out. In the process of doing that, of course, they're jamming things further in and creating tiny little abrasions, that's all bacteria needs. A little bit of place to get some food. Now, understand that when a kid gets an ear infection, it is typically here, middle ear. When an adult gets an ear infection, it is typically here, external. But a kid can also get an external ear infection by the same way, by sticking things in their ears. And they do stick things in their ears. You'll be surprised the things that get pulled out of a child's ear. It's like a magic trick. Just these little handkerchiefs just keep coming out. A little brain attached on the end. That's not true. It would be a great trick though. But that can also cause an external ear infection, otitis externa. Otitis media, middle ear. If a kid has an ear infection, chances are it's here. If an adult has an ear infection, chances are it's there. Does that clear things up? And what was your question?
Do you know that itch that you get that's like in between your ear and like in your mouth?
Yes, how do you scratch it?
I don't know,
I
like,
don't know either.
I'm asking, like, what is that, like, ear related, or?
It's probably more throat related, more pharynx related. Yeah. It's, you know what it is? Eustachian tube related. That's gonna go right in between the two. But it's probably more pharynx related, but I don't know about your itch. My itch is right there. Be okay.
How about when your ears pop?
Well, that's what this is for. This is to help regulate the pressure in between here. And that's just the release of pressure that was against the eustachian tube that is no longer there. Which is why they'll say when you're in a plane and it's taking off, chew gum. Because what you're doing is, you know, you're opening and closing your jaw, and it's changing the pressure that is in here, which is going to allow for that pressure to be released from here. You don't feel it anymore. External, middle, now it takes us to inner ear. The inner ear has a structure called the labyrinth. It's this funky looking snail thing. The labyrinth is this funky looking snail part. And there are three parts to it. The vestibule, where the opening is here, the round and oval windows opening here. And then the cochlea, the snail shell, and then these tubes that stick out the top, it's semicircular canals. Now, you can't appreciate this completely because it's in 2 dimension, but understand these tubes, these semicircular canals are in 3 dimension. So sort of imagine them coming out at you as well. That's an important concept because it is in these tubes where we have a fluid and special sensor cells that help determine balance and positioning. So if one tube sort of comes up this way, one tube is coming out like this, and we'll throw another one maybe like this. If these tubes here have specialized sensing cells in them and a fluid that runs across the sensing cells, if we turn our body this way, you can see how gravity is going to cause the fluid to run down this tube this way. It's going to run down this tube along the side, and then it's going to run down this tube